About how government's supposed to make sure everybody has access, and they will look at the options for achieving that. The first option I mentioned was general taxation. Another option that other countries have looked at is having a mix of public and private providers. And we carefully examined that option because this is BVI, and we know that that is an option that seems very attractive because, many persons have private insurance. But the research pointed to us that that is not a financially viable option for the Virgin Islands. If you allow all the persons of a certain means to opt out of national health insurance, then who is left are typically the persons that the private insurers reject. They consider them uninsurable. They're not profitable enough. They're high risk. So they're persons who have chronic diseases typically. They're seniors. They're persons who don't have the means to contribute at a level that is high enough among that smaller pool to make it sustainable. So having a single pool is the only viable option for long-term sustainability of national health insurance in our environment. And we spoke to the countries like us who chose that option, and they've all told us, don't do it. They're now looking to see how they can transition to what we are doing because they find it unsustainable. It is crippling their national budgets for the same reason. Because one territory we spoke to just recently, they said they tried to address it by passing an amendment to the law that says you're not allowed to refuse anybody that comes to you for insurance. So they can't deny you for pre-existing conditions. So what ended up happening is the premiums went up, $1,000, $1,500 for people who presented a higher risk. Because insurance companies they're not a charity, they're in the business to make money. So if you're going to present, if they see they're going to have to pay out a lot of money for your care, obviously your premiums are going to be at a level that is very high, and unless you're wealthy, most people will still be excluded. So if you try to create a pool and just insure all those people who aren't likely to get insurance in the private sector, then you see the problem.